everybody, this is Sarah Moras, and today I'll be presenting my evidence-based practice talking poster. And my talking poster is in regards to the impact of professional medical interpretation on patient satisfaction and delivery of care, specifically among patients with limited English proficiency. And this is a significant problem not because they speak a different language, but because the language barrier they face when in the hospital setting, that poses an issue in regards to communication. So that language barrier needs to be addressed, especially if the nurse or the provider or the healthcare worker is unable to communicate with them effectively to provide them the care they need. There is some evidence I found, or some statistics I found while researching the literature, and that only 10 to 30% of professional medical interpreters are used when patients with limited English proficiency are provided care. Those are the reasons as to why this is an issue, or this is a significant problem that needs to be addressed. As I was researching the literature, I was hoping to find information in regards to patient safety, but the literature simply isn't there, or the US-based literature isn't there. A lot of it is in Europe, or it's simply too old. So I had to tweak my PICO question, and that is how I arrived to this question of patient satisfaction and delivery of care. So let's see. As I mentioned, the process of the literature, my literature search had to be tweaked based off of what I found. And the three articles that directly answered my question consisted of a mixed method study, a systematic review, as well as a secondary analysis of a random controlled trial. And in the mixed method study, something interesting I found while researching the literature, or something interesting I found in regards to professional medical interpreting, I found that the type of professional medical interpreter service used plays an impact on whether or not a clinician, such as a nurse, will decide to use it or not. And as we've all witnessed, most likely while we're at clinical, there's different types. You can have a person that is an in-person, live person that is a professional medical interpreter, or you can contact a person via video chat or telephone. And the type used plays an influence on whether or not a clinician decides a professional medical interpreter will be used, which is unfortunate, because if they find that it's not worth it to use them, then the patient isn't going to be receiving any adequate professional medical interpretation to discover what is going on in regards to their care. So this study, this mixed method study, found that bedside phone professional medical interpreting wasn't as effective. It was effective in terms of being able to provide interpretation, but because clinicians and nurses didn't want to use it, that posed an issue. Let's see. But overall, my literature search, and the three articles I found all came to the conclusion of that patient satisfaction is increased when the use of professional medical interpretation is used. So that answered my PICO question. Issues that still need to be addressed, and recommendations I have are having hospitals discover the preferences of clinicians, such as our future selves as nurses. What would be the best way to provide professional medical interpreter services that are convenient for the nurses in being able to provide this service to patients. And I also recommend that, regardless of the method available, that providers as well as us as future nurses need to realize the issue of, or the importance of providing professional medical interpretation, and to avoid ad hoc interpreters, which are interpreters that are family members or any other person that speaks the language of the patient with limited English proficiency, but they can't be used because they're not professional interpreters. And that is all regarding my poster. Thank you so much. Take care.